Paid family leave. Is it all that it seems? My name is Andrea Trigvadotter, and I will be sharing with you my 2025 California law analysis on paid family leave. The state of California has had a paid family leave program since 2004. This program ensures that an employee is able to take a paid leave in order to take care of a seriously ill family member, to bond with a new child, or to handle needs due to a family member's military duty. To take this leave, however, you must have had used up your 2 weeks of accrued vacation time. Effective January 1st, 2025, Governor of California, Gavin Newsom, changed the paid family leave program so that employees could take their paid leave without having to use their vacation time. In this presentation, I will discuss the pros and cons of the paid family leave program. The strongest pro argument is that research has shown that paid family leave impacts children for the better. Ruhi Yang and Yang, economic and public health researchers, found that after comparing breastfeeding practices in California with the PFL program and other states without the program, the percentage of mothers who breastfed their infants at important stages of early infancy increased by 10 to 20% when they received paid family leave. Moreover, there was an increase of 3 to 5% in the number of mothers who exclusively breastfed their babies. On top of that, according to researchers at the Centers for Disease Control and Prevention, they found out that women who received 12 or more weeks of paid leave were more likely to initiate breastfeeding compared to women with no paid leave. They add that it was an 87.3% to a 66.7% ratio. This in turn shows the great association between PFL and increasing breastfeeding rates. But why are breastfeeding rates so important? According to the Surgeon General's call to action to support breastfeeding, the risk of hospitalization for lower respiratory tract disease in the first year of life is more than 250% higher among babies who are formula fed than those who are exclusively breastfed at least 4 months. Additionally, formula feeding is associated with higher risks for major chronic diseases and conditions such as type 2 diabetes, asthma, and childhood obesity. So, breastfeeding is better for the overall immunity and health of the growing infant. This shows that when it comes to paid family leave program, it in turn brings better health to children and their future. Although this policy does sound perfect, there are a few negatives. The strongest con side to this paid family leave can introduce discrimination. Goodman, Williams, and Doe, affiliated with Portland State University School of Public Health and Berkeley School of Public Health, researched employed pregnant women in the Bay Area, and they found out that non-Hispanic, Black, and Hispanic women had significantly less access to paid leave through their employers or through government program than their white and Asian counterparts. In other words, women of color seem to have had a harder time accessing the perks of having paid family leave through their employers. Additionally, leave absences introduce organizational challenges and can be expensive for employers. Hence, there may be discrimination against women within the childbearing age due to the fact that they are most likely to take the paid family leave. Employers might not hire perfectly good candidates because they don't want to deal with the challenges of having an employee on leave. This opens up the problem of discrimination throughout the workplace, further opening the discriminatory gap between white men versus women and people of color. In analyzing this law, It's easy to say that there are many more important factors regarding the pro side of the paid family leave policy. Infants deserve to have their best chance at life. On top of that, mothers deserve a break and a chance to heal from the stress and pain that comes with childbirth. Ultimately, supporting paid family leave would be supporting the well-being of new families as a whole. This is my works cited. Thank you very much.